Pass OSCE with polite communication. Master please, thank you and patient consent skills. Why it's important in OSCE and nursing. Politeness equals professionalism. It's part of the communication and interpersonal skills marks in OSCE. Gratitude builds rapport. Saying thank you makes the patient feel valued. Permission equals respect plus consent. Always take permission before touching. First impressions matter. Starting with polite phrases sets the tone for the whole interaction. Where and when to say please and thank you. Introduction and patient identification. 1. Greeting. Hello, my name is, I'm one of the nurses today. Smile, polite tone. 2. Requesting ID details, use please. Could you please confirm your full name and date of birth? 3. After the patient answers, say thank you. Thank you, Mr. Smith. 4. If you need to check their ID card, permission first. If you don't mind, may I have a look at your ID band? 5. After touching or holding ID band. Thank you for allowing me to check. 6. After verifying ID details. Thank you for confirming your identity. Before any physical contact or procedure. Golden rule, every time before touching ask permission. Before taking vitals. Is it okay if I check your blood pressure now, please? After they agree and you finish. Thank you for your cooperation. Before an assessment. Would you please roll up your sleeve for me? After they do it. Thank you, that's perfect. Before wound care. If it's alright with you, I'd like to assess your wound now. After you finish. Thank you for letting me do that. C. During explanations. When giving instructions, place please before the action you need. Please take a deep breath in for me. Please let me know if you feel any discomfort. After they follow your instruction. Thank you, that's very helpful. D. Closing the interaction. Before leaving. Thank you for your time today, Mr. Smith. Please press the call bell if you need anything. The power of acknowledgement in patient concerns. Purpose. Shows you hear the patient's feelings. Builds trust and emotional safety. Prevents the patient from feeling ignored. When to use. Immediately after a patient expresses worry, discomfort, or fear. Before you jump into advice or solutions. Examples of natural acknowledgement sentences. I understand that you're feeling anxious about this. That must be difficult for you. I can see why that would worry you. I hear what you're saying, and I understand your concern. It's completely understandable to feel that way. OSCE tip. Do not cut the patient off with solutions. First acknowledge, then proceed. Keep tone warm, gentle, and sincere. Confirming patient agreement after suggestions. Purpose. Ensures the patient is part of the decision-making. Demonstrates respect for autonomy and shared decision-making. Meets OSCE marking criteria for patient-centered care. When to use. After you explain a plan, procedure, or advice. Before you proceed to the next step. Example phrases. Does that sound okay to you? Would that work for you? Does this plan make sense? Are you comfortable with that? Shall we go ahead with this? Why it's important. Confirms understanding and consent. Allows the patient to voice concerns early. Strengthens the therapeutic relationship. Linking politeness plus acknowledgement plus agreement in OSCE flow. In every OSCE station, use this 3-step communication cycle. 1. Politeness. Would you please, / may I, / if you don't mind? 2. Acknowledgement. I understand how you feel, / that must be hard for you. 3. Agreement check. Does that work for you, / would that be okay? Must say thank you moments. 1. After the patient confirms their identity, name, DOB. 2. After the patient allows you to check their ID band. 3. After the patient cooperates with physical touch or procedure, e.g. Rolling up sleeve, blood pressure check. 4. After the patient follows instructions during assessment, e.g., breathing deeply, moving limbs. 5. After completing a procedure or assessment, e.g., wound check, injection. 6. When the patient answers your questions or shares information. 7. At the end of the interaction before leaving the patient. 8. After the patient gives consent or agrees to the suggested plan. Must ask permission moments before touching patient. Before touching or checking the patient's ID band. Before palpating the abdomen or any physical exam. Before rubbing the patient's back or skin, e.g., after vomiting or discomfort. Before taking vital signs, blood pressure cuff, pulse, temperature. Before giving injections or cannulation. Before assisting with repositioning or moving the patient. Before removing or changing dressings or wound care. Before touching any medical devices or aids on the patient, oxygen mask, catheter. Before intimate or sensitive examinations, e.g., breast, genital exam. Before helping with personal care, bathing, toileting. Key formula. Politeness before the request, permission before the touch, acknowledgement before advice, agreement before action, thank you after cooperation.